Imagine this scenario: you break your right arm and have to wear a cast for a month. During that time, you can only train your left arm. When the cast comes off, what if your right arm was actually stronger than before? Sounds impossible, right? But this is exactly what we're exploring today. And it's one of the most fascinating phenomena in human physiology. When I first encountered this concept, I was skeptical. How could a muscle that hasn't been trained possibly improve? Yet decades of scientific research have proven this remarkable phenomenon exists. It's called cross-education, and it's the neurological process where training one limb creates positive adaptations in the untrained opposite limb. The numbers are truly staggering. A comprehensive meta-analysis from Edith Cowan University in Australia analyzed 96 studies in 2020. The results showed that training one muscle for 8 weeks led to an average 11.9% strength increase in the untrained opposite muscle. That's not a small improvement. That's genuinely remarkable for a muscle that never exercised. Even more surprising, this effect extends beyond strength to muscle mass itself. A 2019 study from the University of Tokyo found that 6 weeks of high-intensity training on one leg resulted in a 3.2% increase in muscle mass of the untrained opposite leg. This was measured directly using MRI scans, providing objective proof of this phenomenon. So how exactly does this work? The answer lies in 3 fascinating mechanisms within our nervous system. First is neural adaptation. When you move your right arm or leg, specific neurons in your brain's motor cortex activate to control that movement. Here's where it gets interesting. Neurons controlling the opposite side also activate simultaneously. German researchers at the Max Planck Institute used fMRI to observe that when subjects strongly gripped with one hand, the opposite brain hemisphere showed a 23% increase in activity. This demonstrates that our nervous system doesn't control left and right sides independently, they're interconnected. The second mechanism involves signal transmission through the corpus callosum, the massive neural bridge connecting your left and right brain hemispheres. This structure contains roughly 200 million nerve fibers. Research from the University of Toronto in 2021 showed that during strong muscle contractions on one side, neural signals transmitted to the opposite hemisphere increased by an average of 34%. Third is the systemic hormonal response. High-intensity exercise triggers release of anabolic hormones like growth hormone, testosterone, and IGF-1. These circulate through your bloodstream, affecting muscles throughout your entire body, not just the ones you're training. University of Connecticut research demonstrated that training one arm elevated blood IGF-1 levels equally in both arms. Interestingly, cross-education effects aren't uniform across all muscles. Upper body muscles show particularly strong responses. Swiss researchers at the University of Basel found that 8 weeks of training one bicep improved the untrained opposite bicep strength by 16.3%. This is roughly double the effect seen in leg muscles. Lower body muscles still benefit significantly, though to a lesser degree. Norwegian research from the University of Bergen showed that 12 weeks of training one leg improved opposite leg strength by 8.7%. The most fascinating aspect is how muscle fiber type influences these effects. Fast twitch or type 2 muscle fibers demonstrate greater cross-education benefits. This means explosive, high-intensity exercises produce stronger crossover effects. Danish research from the University of Copenhagen proved this definitively. Training at 85% or higher of maximum strength produced cross-education effects up to 19.2%, while training at 60% intensity only achieved 6.1% improvements. Higher intensity clearly produces superior results. How can we apply this knowledge? Practically, the primary application is injury rehabilitation. Many physical therapists already utilize these principles routinely. Consider someone with a right shoulder injury who cannot move that arm. Intensive left shoulder training can significantly reduce right shoulder strength loss. Clinical research from the University of Nebraska Medical Center found that patients who trained their healthy arm, while the injured arm was immobilized for 6 weeks, experienced 41% less strength loss compared to patients who did nothing. Second, cross-education can correct strength imbalances. Many people struggle with left-right strength differences, focusing intensively on the weaker side, while utilizing cross-education effects from the stronger side can help restore balance. Third is training efficiency. For time-constrained individuals, knowing that training one side benefits both sides can dramatically reduce workout duration. While not as effective as training both sides directly, it's far superior to not training at all. However, important limitations must be acknowledged. Cross-education effects are definitely smaller than direct training effects. If directly trained muscles improve 20%, the opposite side typically improves about half that amount, around 10%. These effects primarily result from neural adaptations rather than muscle growth, meaning strength improvements exceed muscle mass increases. For muscle hypertrophy goals, both sides must be trained directly. The longevity of these effects is also limited. University of Liverpool research showed that strength gains from cross-education decreased to less than half within 4 weeks of stopping training. To maximize cross-education effects, several factors are crucial. Training intensity is paramount. As mentioned, you need to train at 80% or higher of maximum strength. Roughly weights you can only lift 5 to 8 times. Training frequency matters significantly. 3 to 4 sessions weekly proves most effective. McMaster University research in Canada found that twice-weekly training produced limited cross-education, while 4 times weekly achieved maximum benefits. Exercise complexity also plays a role. Multi-joint compound movements produce greater cross-education than simple single-joint exercises. For example, one-arm rowing or pressing movements are more effective than simple bicep curls. For practical programming during injury situations, I recommend training the healthy side 4 times weekly at 85% intensity for 5 sets of 5 to 6 repetitions each. Rest 3 to 4 minutes between sets for complete recovery, and prioritize compound movements over isolation exercises. In normal circumstances, when correcting imbalances, train the weaker side first. Then match that intensity with the stronger side. The weaker side can perform an additional 1 to 2 sets to accelerate catch-up progress. Cross-education has exciting applications for elderly populations. Older adults often have joint or muscle problems preventing bilateral training. Consistent training of the healthy side can help maintain overall strength. University of Illinois research with participants averaging 72 years old showed that 12 weeks of single-leg training improved untrained leg strength by 9.4% and significantly enhanced daily function scores. Athletes can also benefit from cross-education during injuries. When competition side injuries prevent normal training, intensive opposite side training can minimize performance decline. Many professional sports teams already employ these principles through their strength and conditioning programs. However, cross-education isn't a magic solution. For skills requiring precision or coordination, direct practice remains irreplaceable. A tennis player can't improve left-hand technique by only practicing with the right hand. Individual variation is also substantial. Some people experience dramatic cross-education effects, while others notice minimal changes. This depends on nervous system characteristics, training history, and genetic factors. Despite these limitations, cross-education demonstrates the remarkable adaptability of human physiology. The fact that training one side affects the opposite side reveals how sophisticated and intelligent our bodies truly are. Understanding and properly applying this phenomenon enables faster injury recovery, efficient strength, imbalance correction, and effective training within time constraints. Physical therapy and rehabilitation fields already utilize these principles extensively, with continued development expected. Future research will focus on identifying which exercise types maximize cross-education effects. methods to reduce individual variation, and techniques to extend the duration of these benefits. Now you understand this amazing fact about unilateral training, creating bilateral benefits. This doesn't mean you should abandon training both sides. But during injuries or special circumstances, this knowledge becomes invaluable. By understanding and wisely utilizing our body's mysterious capabilities, we can achieve more effective and safer training outcomes. I hope today's exploration of education helps you build a healthier, more balanced physique. If you found this information valuable, please like this video and subscribe for more science-based fitness content.